is that we reject the central imposition of private providers. This must be a decision for local commissioners focused on quality and value for money. We'll move away from centrally imposed tariffs, the so-called payment by results. This rewards hospitals for admitting more and more patients, racking up large surpluses as a result. The real objective should be to avoid unnecessary hospital admissions, caring for people better, closer to home. But critically, our approach is a twin shift of power. Local accountability and local power, but also people power, giving real control to individuals, putting patients in the driving seat. Our Patients' Bill of Rights. A guaranteed right to treatment within a defined period of time, your treatment paid for privately if that time limit is missed. A right to choose, with your GP's advice, the appropriate clinician and to have a central say in treatment options. The right to information to guide your decision-making and the support of an independent patient advocate if needed. Our people's NHS will see direct payments and individual budgets used by those with chronic long-term conditions and in mental health services. It's worked in social care and it will work in the NHS. And I believe that local health boards should also be free to pilot this approach in other areas, such as maternity services. The traditional model is under enormous strain, and that's not just due to Miriam and Nick. You're supposed to laugh then. But new thinking is needed. We need more GPs and dentists in disadvantaged areas. Proportionately, there are almost twice as many GPs in Northumberland as there are in Barking and Dagenham. That's crazy. GPs working in the wealthier areas where the problems of health are less than in areas like Barking and Dagenham. In my view, we should be providing incentives to doctors and dentists to work in these communities. I call this a patient premium. And patients will have the right to change their GP if they're not satisfied with the service that they're getting. And finally, I want to focus on the most fundamental way in which we can reduce cost and improve people's lives. Helping people to stay healthy is the key. And the challenge is, as we know, greatest in our most disadvantaged communities. There's a shocking link, between obesity, smoking rates, drug and alcohol abuse, and deprivation. And we know that health inequalities are getting worse, shameful, under a Labour government. So health promotion will be at the heart of the work of our health boards. Labour believes you deliver change through a Whitehall diktat which says the priority will now be prevention. How wrong can you be? Diktats don't work. Real change comes from genuine local engagement, involving people, health services, working together with housing and education and community regeneration, and the voluntary and private sectors. We'll give communities the power to raise a proportion of their revenues locally. Then our health boards can innovate to enable and encourage local people to improve their health. Incentives could be offered to encourage employers to provide fitness facilities or gym membership to overweight people who can't afford the normal fees. Health boards, could follow Nova Scotia's lead by offering a tax-back payment for each child enrolled in sports or activity clubs. What better way to help prepare for 2012 and beyond? Or they could adapt a scheme from South Africa, which incentivises adults who attend checkups, nutrition assessments, or preventive screening tests. Using locally raised resources, why shouldn't health boards create direct incentives, tax-back payments, particularly focusing on disadvantaged communities? For the same price as a packet of cigarettes, people could be given a weekly helping hand to improve their health. And we should learn from the experience of one scheme in California. There, an intense focus on those who smoke, encouraging them to join cessation schemes, providing support and guidance, has reduced the smoking rate of those involved by more than a third, literally saving lives. We need to learn the lessons from studies also which show that children who experience domestic violence, sexual abuse, or drug and alcohol addiction at home are far more likely to go on to suffer poor health in later years. By investing in effective, intensive early intervention schemes through schools, health visitors, nurses, and other professionals, our health boards will cut costs in the years ahead, whilst more importantly, transforming youngsters' lives. Some of these schemes will work better than others, but overall, they'll provide the win-win of better health at reduced cost. We know that empowering organisations drives innovation. Leaders emerge and others can follow. This is a fundamental shift from Britain's dependency culture that afflicts this country. No power to affect change, so all you can do is blame Whitehall, and they never listen. So individual encouragement, support and incentives are the key. But what about the other side of the coin? As a Liberal, I'm guided, as I'm sure many of you are, by John Stuart Mill. People should be free to behave as they wish, unless their behaviour has negative effects on others. In those circumstances, consequences follow. For example, take the impact of aggressive drunken behaviour on patients and staff in overstretched A&E departments. In just a 5-month period at the Royal Bolton Hospital, 40 individuals had to be taken outside by security staff because of their antisocial behaviour. There were 41 incidents of staff being verbally abused and 38 cases of threatening behaviour, making it more like a war zone for staff and patients alike. This in a hospital. As Liberal Democrats, we will not tolerate this situation. Now, the Royal Bolton trialled a scheme. Behave in a disruptive or threatening way, and you could be slapped with an £80 penalty notice for disorder or even arrested. The hospital working together with the local police. The effect has been very effective. It's changed the culture in that hospital. So my message is clear. If you suffer from an alcohol problem, then you will be helped and supported to combat that most pernicious illness. But if you gratuitously get yourself smashed and your behaviour interferes with the work of hard-pressed staff, then you'll face the consequences of charges in cash and the courts. Now, that's not the only irresponsible behaviour that needs tackling. Now, some patients have legitimate reasons for not keeping appointments, such as their condition that may make them forgetful or suffer real stress. But for the rest, we should perhaps consider hitting the most persistent offenders in the pocket by letting doctors and dentists levy a discretionary charge of, say, £10 for missing an appointment. Missed appointments are costing the NHS a fortune. That would help make sure that they don't miss them in the future. Liberal Democrats, just as 60 years ago, we must now take the lead in the healthcare debate. The next election presents a real opportunity for change. Tory change is a mirage, destined to disappoint, destined to fail. Our change is very different. A people's NHS, controlled and owned by communities and by patients, making much more effective use of resources, freeing up funds to guarantee decent treatment for those with mental health problems, ensuring access to new, innovative drugs readily available elsewhere in Europe, and fair funding for people in their old age. These are our values. That is our vision. Let's go out and make it happen.